Joining us for a discussion on this, we have Professor Dr. G.C. Khilnani, Chairman of PSRI Institute of Pulmonary Critical Care and former HOD, Pulmonary Medicine at AIMS. Thank you very much, Dr. Khilnani. So, of course, we had COVID, and then we had COVID-appropriate behavior. To what extent, has this brought in a more, people are more conscious of the fact that, we have to fight these kind of diseases as a community?
Thank you very much for having me on the show.
Yes.
This is what you said is very right. COVID has given us so many gifts, and one of the gifts is that people have become aware of their health, and they are aware of the testing, aware of their treatment, because the COVID was a catastrophe which actually affected all of us. As far as TB is concerned, we all know that it is a communicable disease which is transmitted by droplet infection. Although it goes to the lung, 80% of the TB occurs in the lung, but in 15 to 20% of people it can affect any part of the body, whether it is eyes or lymph nodes or heart or brain or bones or skin. So therefore, if we are able to control the lung tuberculosis from where the TB is transmitted, then the transmission is stopped. So how do we diagnose lung tuberculosis? Is by examination of sputum, and there has been phenomenal increase in the services of diagnosis of tuberculosis in our country. Especially the basis of diagnosis was sputum examination.
Yes.
For which the sensitivity was little low. Now there are biotechnological based examination called Gene Expert and also TB, where the diagnosis can be achieved by only in 2 hours time, even if there are only 10 bacteria per milliliter of sputum. So what it leads to is early diagnosis and accurate diagnosis, and it also gives us an idea of resistance to tuberculosis. And over and above, previously there was an intermittent therapy regimen. The treatment was given thrice a week. This has been converted into daily regimen, but it continues to be a directly observed therapy short course, what is called a DOTS.
Yes.
Now the good thing is that these facilities are available in the most extreme interior of this country, and the credit goes to the government of India for giving all these free services. So finally, if I say that if we are able to diagnose all cases of tuberculosis and give treatment on a regular basis for a period of 6 months, we will be achieving a goal of end TB by year 2025. This will also lead to reduction in the genesis of multi-drug resistant tuberculosis, which is mainly because of the non-compliance and irregular treatment. Thank you.
Indeed. When should a person go and test for TB? When do they feel like they actually have TB? Some of the reports suggest that, if you have a cough for over 3 weeks, that's when you should go.
Now, yeah, that's a very good question. The most common, as I said, 80% of TB is in the lung, and the most common symptom is cough. As per the national program, anybody is having unexplained cough for more than 2 weeks should go for sputum examination. But as the 20% of TB occurs in the organs other than lung, the other symptoms are if the person is having low-grade fever for prolonged fever, which is not responding to treatment,
Okay.
or the patient is having loss of appetite, or he gets night sweats, or feels tired in the evening, which is there for more than 2 to 3 weeks, or chest pain, or if he spits out blood. These are the main common symptoms of tuberculosis.
Okay.
Symptoms will depend upon whether the lymph node is affected, or the heart covering is affected, or the brain is affected,
Yes.
or the skin is affected. These symptoms will be determined by that. But the common symptom is fever and cough. Thank you.
We leave. So let's talk a little bit about the non-compliance aspects. People feel that they are cured within a few weeks' time, and they stop taking the medication. How serious a concern has this been, and to what extent has tuberculosis evolved into multi-drug resistant or XDR, extreme drug resistant?
Yeah, so that's a very good question, because 30 years back, multi-drug resistant tuberculosis was considered almost like a death sentence. It is a man-made problem, because when the tuberculosis occurred several thousand years back, there was no MDR TB. MDR TB occurs because the resistance is generated either because the number of drugs which are given to the patient are not correctly given in numbers. Like instead of 4 drugs, if you give 1 or 2 drugs, there will be genesis of resistance. But the most common cause of genesis of MDR TB is non-compliance. The non-compliance could be because of several reasons. One of the reasons is that patient is not able to afford that and not able to buy it. One of the most important causes is that patient starts feeling normal within 4 to 6 weeks of starting the treatment, and he feels that he is cured of the disease.
Yes.
So therefore he stops treatment. And third reason is some side effects occur, and some few reasons are there. The dosages may be suboptimal, or there is absorption problem.
Right.
But with the implementation of the directly observed therapy, the non-compliance is taken care of, because the healthcare worker or ASHA worker
Yes,
or
yes.
somebody actually sees that the patient takes these medicines regularly. If there is a full compliance of the with the anti-tubercular treatment, the genesis of MDR will be largely curtailed. And also I want to
Right.
emphasize here, the government of India has started the program of DOTS Plus.
Yes.
That means there is a free treatment and diagnostic facilities available for MDR TB also, which are available at specialized centers all over the country.
Right.
So it is a multi-pronged approach in ending the TB.